Hi, my name is Vivian Saturn. I'll be doing this skills video drawing up insulin. I'm wearing the correct uniform. I have my badge, I have all my supplies. My supplies consist of a pair of clean gloves, alcohol prep pads, gauze, my regular insulin, my intermediate insulin, and my needle and syringe. I also have the sticky note. The sticky note is just supposed to show you that there's nothing on the sticky note. I'm just using the sticky note just so that the camera will focus on the syringe later on when I show it to the camera. Also to note, if you see my video become blurry here and there, that's just because my camera is trying to focus on me, but I swear the video is not edited in any way, shape, or form. Last thing to note, I'm coming down with something, so you may hear my voice change here or there. You may hear me clear my throat, or you may see me swallow, which can cause me to pause here and there. Yeah, I just want to apologize in advance for that. Okay, now we can begin. The first thing we're going to do is verify the provider's orders. The second thing we're going to do is verify the 6 rights of medication administration, which is the right patient, drug, dose, time, route, and documentation. We will then check the medication order in the EHR, then verify the medication against the MAR for the first time. We're supposed to do this 3 times before we ever administer medication. The medication order today reads that this particular patient needs to have 4 units of regular insulin and 8 units of intermediate insulin subcutaneously every morning before breakfast. Now this is only going to be 1 injection, so that means we are combining these 2 into 1 syringe, which will total out to 12 units of insulin. Now that I've verified that, I'm going to take all my supplies, go to my patient's door, knock on my patient's door, enter the room, close my patient's door, close my patient's curtain to ensure patient privacy. I'll put my supplies down on a flat, dry, clean surface, perform hand hygiene, and introduce myself to my patient. Hi, my name is Vivian. I'll be your nurse today. Can I have your full name and date of birth? As the patient speaks, I'm going to do 2 patient verification with the wristband. It is the correct patient. Okay, Mr. Smith, are you allergic to any medication, any food, or environmental allergens? No? Perfect. Give me 1 second, okay? This is where I verify against the MAR for a second time. So far, we are good to go. Okay, Mr. Smith, today you're getting an injection of insulin, and I have to explain some things of insulin to you. So insulin is supposed to be a diabetic management. It's supposed to help draw glucose from your blood into your cells to help with energy. And you have 2. You have regular and intermediate. Now regular is short onset and short duration, meaning it's fast acting, but the effects will not last very long. And you have intermediate insulin, and what intermediate insulin does is the same thing as regular insulin, except for it is a longer duration and a longer onset, meaning it will take some time to activate, but the effects will last longer. So those are the 2. Now you have some common side effects with any medication that it can be given to a patient. Now the common side effects are meaning what we expect to happen when we give you this medication, and some common side effects are sweating, weight gain. You could also have pain at the injection site or nausea. Now, adverse side effects meaning what we absolutely do not want to happen. Adverse side effects are seizures. You could potentially have seizures. You could be hypoglycemic, meaning you have low blood sugar. You could also have hives. You can also have hives. So those are the things that you have to look out for. If they happen, you have to let me know as soon as possible, and I'll notify your provider immediately, okay? On a different note, when you get this injection, when I administer this injection, you may feel a slight burning or stinging sensation. That is normal, okay? Any questions, comments, or concerns? No? Perfect. Give me 1 second, okay? This is where I would check the medication against the MAR for a 3rd time. And so far, we're good to go. So then I perform hand hygiene. And yeah, we can begin. So, Mr. Smith, we would have to check your glucose levels first. And we have done that. And your glucose levels today is 110. So you're good to be administered insulin. Now, after we give you this injection, you will then, after 30 minutes, you will get a breakfast tray, okay? I know you may feel a little bit hungry, okay? So now I'm going to check my medication against the MAR, and I'm going to ask another RN to help come verify. So we want to make sure that we have intermediate insulin, and that we have regular insulin, and that when we look at the MAR and our vials to make sure that's what we have, that we are comparing the units. So we would have 8 units of intermediate insulin, and we have 4 units of regular insulin, and when we combine that, it'd be 12 units of insulin. Right now that has been verified by the RN, by me with the MR and so on, I'm going to take these vials and I'm going to rub them in between my palms to make sure that they're mixed really well and that they are room temperature, and that is good. Now I'm going to take an alcohol prep pad. Now these are open, but in real life we would not use an open supply. So then I'm going to take this, I'm going to dispose of that in the trash, and then I'm going to wipe the tops of the vials and I'm going to let them air dry. I'm going to dispose of this in the trash. Now I'm going to take my syringe and my needle. My syringe is 100 units and my needle is a 29 gauge, 1/2 inch. All right, and then we're going to dispose of this. Now before we uncap this, we're going to draw some air and we're going to do 8 units of air. All right. Yes. Now we're going to uncap this, okay? And then we're going to do our intermediate vial first. We're going to inject 8 units of air into this vial. We want to make sure that the syringe, the needle, is not touching the solution at all. We're going to administer that. Now we're going to withdraw the syringe, making sure that it does not aspirate the medication. Then we are going to withdraw 4 units of air. And then we're going to insert 4 units of air into the regular insulin vial. Nice. Now that we've inserted it, we're going to invert the vial. We're going to draw up 4 units of regular insulin. Yes, I want to make sure. Make sure that we draw 4 units of insulin, regular insulin. Yep. Okay, now we're going to take that out. All right. Now we're going to flick off any potential air bubbles, and it is clear. Now this is also where we want to make sure that we check it against the MAR as well, and we check the syringe to make sure that it is 4 units of regular insulin, and we use this vial, so it is 4 units of regular insulin. This is recheck. We verify in the syringe 4 units of regular insulin, and then we also check against the MAR to make sure that, again, that is what it says. I could also ask my RN friend or coworker to also check just to make sure once more. We would also then check to make sure that it's 8 units of intermediate insulin, then also recheck our math to make sure it equals 12 units of insulin in total. So yes, 4 units of regular insulin, and then we check the MAR and so on, that it would be 8 units of intermediate insulin. Together will make 12 units of insulin. So yes, this is good to go. I don't know if you need to see this, but here it is. I don't know if you can see it. There you go. Okay, now we're going to put this syringe, without drawing in any air, we're going to put this syringe in the intermediate vial. Okay. We don't want to push on the, I don't even remember what it's called. We don't want to push at the end and accidentally inject the regular insulin. So what we're actually just going to do is we're just going to draw the 8 units of intermediate insulin. And we made sure no air bubbles. We want to make sure there's no air bubbles, and as well as we want to recheck and verify the units. So yes, it is 12 units of insulin. and this is the bottle we did use. We're just rechecking and verifying the units in the syringe. Yes. Let's see if we can show that to you as well. Can you see it? Please tell me you see it. Okay. And then after that, we're going to use the swoop method. So we're not going to cap it with our fingers. We're just gonna cap it by swooping it up. Yes. Like so. And we're not going to use this just yet, because we're going to be slightly away from the bedside. So what we're going to do, since we're not using it yet, we're going to label it with the name and then with the dose. And for the dose, we're going to do the individual doses. So for example, the intermediate was 8 units. So that's what we would put on the syringe. So after that, I'd make sure to have a clean area, take off my gloves, and throw that away, perform hand hygiene, and go document the procedure.